Hi, I'm Dr. Jason Goodchild at Premier Dental, and today I'm sitting with Dr. Lori Trost. Um, and I wanted to catch up with her to find out how she's doing with her practice, what she's seeing, how she's managing. I know that she's done a recent webinar on practice resiliency. And so I really wanted to touch base with her to find out what she's experiencing, what she's going through. So Lori, thanks for the time today.
Thank you, Jason. Great to talk with you. And
Yeah.
I appreciate the conversation because I think right now, the more that we all can connect during this kind of crazy downtime, for lack of a better term, forced downtime is, I think, a really important thing because we're all kind of wanting to reach out. We're very social people by
Yeah.
nature as dentists anyway. And to have
Yeah.
conversation is really important.
Yeah, thank you. From the dentists and dental professionals I've been talking to, everybody's kind of sharing what they're going through and what the state of their practice is. But before I ask you about that, you wanted to see, how are you doing? Is everything all right with you?
I'm absolutely fine. Yeah, well, family's well, and I hope your family is too.
Yeah, we are. We're hunkered down. We're doing all the things that everybody's been recommending. We're starting to running a little low on food. TP still okay, but hopefully you guys are doing good as well.
Yeah, the essentials. It makes you appreciate going to the grocery store right now, and
Yeah.
what's maybe on the shelf or not on the shelf right now. So
Yeah, so true. Um, But what is the state of your practice right now? Are you guys open, not open to seeing emergencies? What's going on?
yeah, so I practice in Illinois, and 2 weeks ago, this is actually week number 3 now, technically, of the recommendation by the Illinois State Dental Society that they encourage dentists to really not see patients other than an emergency basis. So that's what we're doing. We're taking the utmost precautions. The nice thing about my practice that I have right now, it's very boutique-esque. I see one patient at a time, so it really pars down that situation. So we'll
Yeah.
have a patient who we literally will be in their car. We text them ahead of time. They come in, they use hand sanitizer. They do not even sit in our reception area. They come alone. They are ushered in then to the chair where we go ahead, seat them, and then we do a pre-rinse. We're doing peroxide, 4% peroxide. So we're following all those guidelines.
Yeah.
Of course, we're using the utmost of the PPEs, the personal protection equipment. So we're really mandating that and really have created our own protocol with that and then managing the emergency as such. So it's a different time, before we
Yeah.
had maybe clipboards or sign-in sheets or maybe a pad that you had people, there's nothing like that now. There's no magazines. Our reception area is so bare right now. It's even kind of ironic that I even sit here right now as we talk, but that's what's going on. And we've minimalized everything literally across our countertops, counter spaces, anything that could be touched with an aerosol. So the less to clean is all the better for all of us.
Yeah, and you had mentioned texting. So when the patients come, that they would wait in the car, you would text them when you're ready to see them. Um, is that how you're also communicating with the rest of your patients? Is it maybe via website, via text, through phone calls? How are you staying in touch with your patients?
Yeah, great question. So what we're using right now, we use a patient communication system called Weave, and it's two-way texting that's private and extremely convenient. So people have that utmost consideration that, hey, I can text back and forth. It's private. It's just between us two, and it really links us. And we're able to push out messages through that. And I've had people even text me the simplest questions like, should I get rid of my toothbrush right now? Okay, how long can my toothbrush last? I mean, that sounds like a crazy question, but people are worried.
Yeah.
People have a lot of misinformation out there. So I think the more education that we can push out and the better we can stay connected, it's all the better for all of us.
Yeah, before we got on today, we were having a little bit of a pre-conversation about teledentistry, and you'd mentioned that you'd seen a lot of cell phone pictures of teeth recently. Is that something you're doing a lot more of right now?
Absolutely, too. We're having patients, again, using their smartphones. The nice thing with Weave, we're able to really manage just patient to patient pictures, conversation. We're doing pre-screening, too, through that patient communication system. So we're able to have patients fill out all the paperwork ahead of time in case that is, in fact, emergency that we've never seen them before.
Mhm.
We're also having them with the pre-screening answer very important questions, fevers, travel, who have you been in contact with, all of those type of very pertinent informational details that we need to have for assessment before we even see them.
Yeah. And how's your team doing? Everybody, you'd mentioned that your office is sort of still intact, but how's everybody managing this crisis?
We're doing actually very well right now. It's interesting how it's a day at a time. Sometimes it's an hour
Yeah.
at a time. And we're just trying to make the best of it, keep the morale up and making sure that we're very positive. And we have plenty to do. We're staying busy.
Yep.
There's a lot of things to do in the background. I don't care. I mean, one of the biggest things I think you and I talked about before we actually started this whole discussion was what are we doing right now to make sure that we're ready for that next wave or that phase or when patients start coming back. So we're looking at inventory. We're looking and taking really great assessment of all of our systems, all of our protocols, everything that we do to make sure that everyone is in place and will be ready and in place and be safe when they come back too.
Yeah, and that leads me into kind of what I want to do next with is kind of ask a couple of rapid fire questions of you, because when you think about the dental industry currently, and then maybe looking ahead the next 3 to 6 months, um, and then maybe even we'll get into. I know that you and Dr. Perry have done some work on business resiliency. So my first question is around purchasing. When it comes to supplies now, you guys slashed and burned. I mean, just kind of the barest minimal kind of approach, or are you focusing on PPE? What are you doing with ordering right now?
So excellent question. I think that's really on everyone's mind. I think right now, for all of us, we need to start with an inventory. We need to know what we have, and often we don't know what we have. So you might have material that was expired. You might have a material that's going to expire out the next, say, 3 months. And I think we need to be really prepared for that. I think from my understanding, many of the manufacturers have really halted production on a lot of the products. And so because of that reason too, we need to be prepared. So we might want to get that in the funnel and know that maybe a target date of when we can really return and fire back up with patients. So we need to make sure that we are totally prepared for that, because there's going to be a big wave that's going to hit us with patients coming back. And honestly, it's going to be a very gradual type of introduction with patients coming back too. And Ron Perry and I, we did a program actually yesterday. It's going to be coming out this week on resiliency. And one of the issues that we are going to identify is you have two issues. You have to, number one, obviously be financially checkpointed, and I'll talk a bit about that. But more importantly, you're going to have a graduated reentry of your patients. So you're going to have to really assume a whole protocol on infection standards. More importantly, you're going to have to make sure that you really create a loyalty and a trust factor and really instill that with patients, because this is kind of like remember back with the Kimberly Bergalis. I call it the Kimberly Bergalis and the 9/11 debacle, because there was so much fear and distrust, and we're going to really regain that. So very, very, very important to make sure we have that happen, number one. With the financial checkpoint, let me go back to that. I think you need to assess everything, look at things with your accountant, get ideas of where you are with your loans. If you need to negotiate, talk to maybe your landlord, look at your leases, look at your rents. You might want to have credit cards really reissued, because that's going to allow you a different credit line on a different credit card. So that's some tactics that you can use there as well.
Mm-hmm.
I think anything that you can push off right now, you just need to get a good handle on what's happening, because this isn't going to go away in the next month. This is going to be here. We know right now, like you're talking for quarters. So that's a chunk of time, 3 months. So you've got to lay this out and be really prepared for that. So again, all the patients that we're kind of postponing right now and delaying their treatment, you've got to be ready for them in the pipeline. So therefore, that inventory has to really reflect what their needs are and their treatment needs are going to be. And that's how you're going to go forward ordering.
Yeah, I love what you said about not only doing an inventory, but doing an inventory to include your expiry dates, so that you could possibly use up everything you have before you actually had to do some reordering. What about equipment? I don't know if, like when I had my practice, I would, have equipment that I had planned for the year, whether it's going to be, I need a new sterilizer, do something with a chair, a new light, something. Is that one on your checklist as well? Is that, your 2020 plans may need to be your 2021 plans?
So ironically, I have a brand new practice with brand new equipment, but I literally 2 weeks before all this broke out, I got a brand new digital scanner. So here I am, I have the scanner. I am so fired up to start using a digital scanner. I can't even see straight. And here I am now with it sitting there, and I'm looking at this really expensively nice piece of equipment and thinking to myself, did I do the right thing? Yes, I did. Okay, first of all, and I think we have to believe in ourselves, and we
Yeah.
have to really understand deep down, yes. And I factored that in, and trying to be really a good business financial steward of all those things. And I knew that going forward. But what's interesting is you have to go on your gut. You have to plan. You have to make sure that you have that part out. So maybe that equipment piece or that technology piece you want in your equation, you might not be getting that till the third, the fourth quarter. And I think that what's going to happen too is a lot of dentists are really going to, that's going to be a big rush for the end of the year. So you might want to start having those conversations, maybe, around July 4th or so, and then bring your rep in, start to talk to them, start to talk to your accountant and see where things factor out and see what kind of, and I think there's going to be a lot of good deals. And I think with
Yeah.
the SBA loans, those type of things, I think we're going to have a lot of advantage to help us. And hopefully by that point in time, your whole team is back together again and things are really up and running at a better pace. But for right now, it's going to be very pared down. It's going to be a single individual care for a long time. That's not going to change for several months, I think.
Yeah, I agree with you. The uncertainty is the worst part. If you had said, hey, we need to really pare it down for the next 30 days, it's easy to do things when we have a bit of an endpoint or a time frame, but the unknown is so upsetting, as practice owners, as patients,
Yes.
everybody involved. But let's get back to your business resiliency webinar and talk about some of your main points. If you had to think about maybe your top 2 or 3 or 4 main points for dentist practice owners to really consider right now, what would those be?
So I alluded earlier to about the financial checkpoint. I think you need to really get that assessment. And that's first and foremost, because I think once you have that shored up and you have a better idea of what you want to do or need to do, that's going to be better for you in the long run, period. That takes a lot of the pressure, the steam off.
Yeah.
Secondly, I think you need to really have a plan and be a true leader for your team, because I think right now your team is going to look to you to obviously give them a lot of information. I think education obviously is very powerful, but they've got to believe in you, and you need to be their pinpoint for all of that education and really step up and be a true leader. So you've got to get very knowledgeable about this novel virus, because it's, we were here initially 14 days in the transmission window, and now that could be 21 days. Does it stick on cardboard? Are you spraying your boxes with Lysol? I mean, all of these really crazy random things we've never thought about now enter the equation. I think with our team members, again, through our patient communication system, I'm able to have a private chat room. We talk, we encourage each other. We're still doing very important things that really keep us connected. We're doing a lot of things in the background. I don't care if it's insurance processing, shoring up protocols or systems. We're making sure everything's tightened up and revamping a little bit, even refreshing your website. I talked to a colleague last week who's even painting a couple of ops, and within his practice. I mean, whatever it takes, you're doing those things. But the team, I think you really have to shore up. That's the other leg of that stool. And the third leg of that stool, I think, are your patients, where we can create like little fun videos that we're showing them to start having that ground laying work of saying conversationally, hey, we're going to be safe. We're going to take good care of you when you come back. We're going to be ready to be your dentist again, and keep them within that family and that conversation, because they do trust us, and we are family and extension of family to them in many ways.
Yeah, excellent. I mean, just amazing advice. One thing you said made me think of another question, which is when it comes to education or resources right now, is there something special you're doing, places you're going to find great education or resources?
Yeah, so there's some really good programs out there. Dentaltown actually last week had some really good experts on
Mhm.
that really talked
That was excellent.
length, of just really just everything from manufacturing to just day-to-day process and practice. Dr. Gordon Christensen was on, as well as Rella Christensen. So wonderful advice there from them. I think Viva Learning has some really good programs right now on
I
with
agree.
Dr. John Molinari. He's done some things there that really practical, good, sensible things we can take away. Hugh Freedy has a really good one, The Green Light, right now you can go on, again, with infection control.
Mhm.
Companies like Zerk, who have really amazing organizational things, are actually coming in and doing like a virtual organizational tasking within your practice. So you can open up your cabinets and you can virtually go through, and they can help you reorganize things. So to me,
Great.
these are times to take advantage of that and really make that happen.
Yeah, it's so great. I think a lot of companies are trying to do that. Hence, part of our call today. I'm trying from your
Absolutely.
standpoint, we want to trying to reach out to as many colleagues and professionals and kind of find out what they're going through to kind of keep that discussion going, as you mentioned. One other really cool thing that you said earlier that I wanted to kind of bring back up, and then we can wrap it up, was you'd mentioned about hydrogen peroxide, and that knowing that hydrogen peroxide has been shown to kill the virus, whereas the other common rinse that we use in dentistry, chlorhexidine, has not. And so, maybe we're all looking at the same resources, but regardless, it's wonderful to hear that that kind of message is getting out, because we're so used to using chlorhexidine, not so much on the hydrogen peroxide side.
Great. Yeah. Yeah. Peroxide is definitely the one you want to use.
Yeah.
Yeah.
And so, and I had mentioned to you about this earlier, Lori, that when Julie Charlestein and I had this idea to reach out to people like you and other dental professionals, we had made the decision that, we want to do all the serious stuff and catch up about how you're managing with your practice, and really get some ideas, like you said, about business resiliency, how to strive and thrive. And but we also wanted to at least have a little bit of fun and try to be uplifting. And so one of the ways we wanted to do that, we thought, was maybe to kind of an homage to James Lipton, the late great James Lipton from the Actors Studio, is to ask perhaps one of his questions. And so the question that I think is kind of cool to ask dentists and dental professionals, because we are a special breed of people where, unfortunately, we love what we, well, not unfortunately, fortunately, we love what we do. And the reason I was going to say unfortunately is because, even when we're home on weekends, we still like to see teeth. We still read about teeth, and we're just inundated with dentistry in general. That's the unfortunate part, which is hard to separate. So thinking about it that way, the question I wanted to ask you is, if you couldn't be a dentist, one of the things we haven't talked about today about you, Lori, is not only the practice, but the education side of things. And you're involved in so many different things, teaching CE all over the country and the world. So I know that you kind of live and breathe dentistry. But if you couldn't be a dentist, do you have any thoughts about what other career you would like to undertake or try?
Oh, that's easy. That's really easy. I would be a musician. I love to play the piano. I dabble at other instruments. I fail miserably at many, but to me, music is just such a universal language, and it's something that I've done from little on, from probably the age of 3 on. And I'm classically trained pianist. I love to play jazz piano. I love all kinds of music, but to me, it's so universal, and it's ageless. It's timeless. It keeps us happy. I mean, I
Yeah.
played the piano yesterday for a little while just because I wanted to. I needed to, and it's something that I can pick up anywhere. I've done it for a few dental colleagues on occasion.
Oh,
Yeah, I've done it at a few different gatherings of fun
that's
folks. We do some different meetings for manufacturers and things, but absolutely love playing, and I want to carry that through hopefully the rest of my life, and share as much as I can with other people.
yeah, Lori, I've known you for a lot of years now, and I didn't know that. And so that's part of the reason why we asked that question, is so that we all can learn a little bit more about you. And that's really cool. And some of the other folks that I've asked that question to, I've gotten some interesting answers. One wanted to start a wine business, which was fantastic, I thought. But as dentists, even though we live and breathe it, we do have other interests. And I can think of nothing better than perhaps after a long, hard day at the office, sitting down at the piano and hopefully getting it to relieve some of that stresses from that work day.
For sure. Yeah. It's
Yeah.
wonderful.
So I hope that you guys continue to do well out in Illinois, and everything continues to do great for you. I really appreciate the time, Lori, today. And I'm hoping that this is short-lived, but if it goes on a little longer, perhaps I'll check back in with you, if that's all right.
I would love to talk again. Hopefully we won't have to. I am going to remain very hopeful.
Yeah.
Yeah,
Well, I
for sure.
appreciate it, Lori. Thank you so much.
Thank you, Jason.
All
Stay
right.
well.
All
Okay.
righty.
Stay safe.
All right.
Thanks.
Bye-bye.
Bye.